The objective of covering informal sector workers with a large benefit package that's the same for everyone in the country will probably take decades, and vast amount of money, public subsidies are going to be required to cover them. And governments not only should be aware that benefits for informal sector workers may have to be limited, but also governments should not expect to collect much in the form of informal sector workers' contributions to the health sector. That's the end of my presentation. I've been talking for nearly 30 minutes. I'm going to shut up now.
Okay, thank you very much, Ricardo. That was very interesting. In order for us to process a little bit better what you presented, I would like to ask our audience of about 30 people to vote on these questions. So who is classified as an informal sector worker? And the idea is that you answer this from your own experience in your own country. So we see some results coming in, and it's all over the place in terms of numbers. And I guess that goes to that speaks a little bit to how difficult it is to define this group of people. I think we're probably almost there, so I would like to give it maybe a couple more seconds. Okay, let's move on to the next question. So the next question is, what are the causes of limited access to health services? And you can, again, select all that apply from this list, and it's what is relevant to your experience in your country. So I think we see a convergence on A and B, the relative cost of insurance for the poor and in communities with no or substandard health clinics. That seems to me to be the commonly agreed cause of this. Okay, I think we're about done with this question. Let's move to the next one. So, which of the following is the best way to maintain a successful healthcare service for the informal sector workers? So, I guess you can here only select one. So, what do you think? It's government programs, it's community insurance, NGO clinics, universal healthcare with subsidies, finance health insurance with portion of all government revenues, tariffs, and taxes, or all of the above. Okay, so it seems like majority of us would prefer a universal healthcare system with subsidies, or to have a budget, a government revenue finance system. So, Ricardo, I would like maybe if you could comment on these results a little bit in view of what you found in your study?
Sure. What I found in my study is that governments in developing countries often have tight resource constraints, and therefore they're not in a position to subsidize healthcare for everyone. So typically, health policies consist of systems in which the non-poor have their own health insurance, which they finance themselves with their own contributions. And also, the poor and the vulnerable tend to have access to free health care, which is fully subsidized by government. And in the middle remains the challenge of this large chunk of the population that's in the informal sector. And for them to have health insurance, what I have learned is that government should be ready to subsidize a big portion of their healthcare costs, and government should not expect to draw much in revenue from them. And in addition to that, the size of the benefits package government should offer to this group that's in the middle should not be as large as a benefits package of those who self-finance healthcare, and it should not be as small as the benefits package of the poor. It should be somewhere in the middle.
Thank you, Ricardo. So I think we're now ready to move into a question and answer period. And so for the participants, you can pose your questions by typing them in the chat area. There's a white box on the bottom where you can type. And we will look at them, and then Ricardo will answer the ones that you posed. Okay, so there was one question that I wanted to, or one comment from Manoj Kumarpati. He commented that there are many non-poor individuals working in informal sectors trying to pose themselves as below poverty line to draw the many benefits of the insurance that are meant for the poor, and this refers to India. So I just wanted to, because he typed in a different section, I wanted to highlight that.
I see some questions that are being posed now. Joe, should I go ahead and try and answer them?
Please go ahead. Ricardo, you can just answer them verbally.
Sure. There's a question there on whether or not there is a different approach to occupational injuries versus general sickness and diseases, and the answer is yes in Latin America. I'm aware of the system that most Latin American countries have of a specific insurance for occupational injuries and occupational diseases. It's financed separately from social health insurance, so it's a separate regime. Then there's a question by Allah Hamed that says, why do we then separate between a system for the poor and the informal sector if both would have packages that are not much different between them and the government to subsidize both of them? Well, some countries have chosen not to make a difference between both, but governments are limited in their ability to subsidize healthcare. Now, if you add the poor plus the informal sector, that may represent up to 80% of the population. So government cannot finance services for as many people, and therefore government seeks to get some subsidies, to deliver some subsidies to the informal sector, but also to try and collect some contribution of them. And for them to contribute, then their benefits have to be somewhat higher than those of the poor. Imad El-Azazi asks, would you please give insights on your experience and research about charity and nonprofit organizations' role in quantitative initiatives? What I have seen in Latin America, in Africa, and in Asia is that nonprofit organizations and charities have not played a significant role in solving the problem of providing health insurance for informal sector workers. I think that they have played a very important role in helping with health insurance for the poor, but not as much for the informal sector. Alison Kelly says, hi Ricardo, informal sector workers are so heterogeneous, from poor to rich. In sub-Saharan Africa, where the percentage of the informal sector is so high, one suggestion is that some of the informal sector needs to be formalized. Has that been done successfully anywhere based on your study? Well, formalizing the informal sector can be done, for example, by asking them to identify themselves and to make an explicit contribution to health insurance. And yes, that has been done in most of the countries that I described. By the mere fact that somebody comes and declares their intention to join health insurance, it means that they're being formalized, or that they're identifying themselves. Now, having them formalized by having formal work contracts, and by having them a legal document by which they make contributions to pensions and to health, that has been much more difficult to achieve. Laurel Hatt says, given the conclusion the benefit package might be smaller for the poor, smallest for the poor, small for informal sector workers, what are the implications for equity? Well, that is inequitable. Having different packages for different groups of the population is inequitable. But this inequity naturally comes from the fact that governments in poor countries have limited resources. So governments cannot provide as much as they would like to everyone. And because of perverse incentives that I described earlier, such as adverse selection and misreporting of socioeconomic status, it turns out that as countries evolve and their incomes get higher, it looks like having different benefit packages for different population groups may be a solution. It poses an equity problem, but it is one that cannot be fully solved because of the lack of resources. Lara Brearley is asking, if governments can expand fiscal space, should there be a universal subsidized system in low or middle income countries with a large informal sector? Yes. In these countries, government have been looking for more fiscal space to provide more subsidies for low income and middle income informal sector workers. But oftentimes, those subsidies have been insufficient to provide adequate health insurance for these large groups of the population, which is why governments also try to get some contribution from informal sector workers. Adeola Mayagbe is asking, what did you find provided best financial protection for developing countries? Catastrophic cover versus cover for general diseases. Many countries provide both catastrophic cover and cover for general diseases at the same time. The best coverage for financial protection is catastrophic cover, that is, subsidized health care for costly health services. That is what works best. There are some countries that have separate health insurance funds for catastrophic health care. Mexico, for example, is one of them. Chile has that as well, and they have worked reasonably well, and that provides a fair amount of financial protection. Vini Aristianti, could you please kindly give us your opinion about the best way of initiating the collection of premium from the informal sector workers in a social health insurance scheme? The best way that I have seen is by having social workers in government health facilities, especially in hospitals, but also in health centers. When informal sector workers come to these health facilities to seek free health care, they are subject to a means test. And if the conclusion of the means test is that these individuals are not poor and that they are non-poor informal sector workers, then they're invited to join the informal sector workers regime of social health insurance and to make a contribution. Alright, Manoj Kumar Pati, in my view, in developing countries like India, government should decrease relatively the cost of insurance for the informal sector while decreasing the range of services, but the major challenges for the administrators are how to identify these people and categorize them into a single group. There's always a transition going on between informal sector workers and formal sector workers in countries like India. How to deal with that situation? That is a major challenge. India has recently decided to have, India is a country which relied very strongly on out-of-pocket health financing. About 80% of resources in India for healthcare came from out-of-pocket payments. India has been moving very aggressively implementing government-subsidized health insurance, and one of the risks of these government-subsidized health insurance is that many people who are non-poor are actually will want to join government-subsidized health insurance, and given that resources are limited, there may be many people who are not poor who will try and join these government-subsidized schemes, and that's going to be quite a challenge because government subsidies are limited. Wow, there are many questions here. Let me see if I can move on to the next. Ralph Radermacher. I wish to comment on two topics. A, the right insurance setup, including identification mechanisms leading to reasonable administrative costs. In my experience, a number of schemes aiming at large-scale coverage suffer from some design issues.
Ricardo, can I interrupt you for a minute? I think
Please.
Ralph just made some comments that everybody can read. It's not in the interest of time. Maybe we should move to Lara's question. It's not
Okay.
really a question. He gives some very interesting.
Lara asks how to balance a social cost to equity and right versus the fiscal costs of equalizing benefit packages. This is inherently political, as it's possible the public sector could subsidize a smaller package for all, but the more advantaged are unwilling to give up benefits. Yes, I think, Lara, that you've phrased the dilemma very nicely, and that is precisely what Colombia is currently facing. The government there has decided that they want to give the same benefit package for everyone, irrespective of their income or health status. But it remains to be seen if Colombia's government is going to be able to come up with enough resources to achieve what it wants to achieve for the sake of equity. I myself remain, unclear that government is going to achieve its objective. Ralph, okay, then there's Uzaib Saya. Hello, did you find that informal sector workers may use other sources of financing, such as various saving mechanisms to pay for catastrophic health expenses? Is there a way we can better understand their ability to save and pay for unanticipated expenses such as these? No, there is not much evidence that informal sector workers are saving in anticipation of future healthcare costs. I haven't seen many studies of this. There are countries that have health savings accounts, but these are organized health savings account systems, mostly for formal sector workers. There is literature about mechanisms that community use to help community members pay for high healthcare costs. But these are not initiatives that allow countries to deal effectively and systematically with the major problem of providing equitably health insurance for informal sector workers. These are social attitudes, community responses to social problems such as paying for costly health care, but they are not able to solve the national problem of a large informal sector.
Okay, well, I think this has been a really interesting discussion, and I would like to move on to close the webinar. Ricardo, do you want to say some final words to kind of tie it all together and some parting?
Yes, I'd like. Thank you, Joe. I think that those countries that are facing the problem of a large informal sector that does not have adequate access to health care often fall in the mistake of promising a large set of benefits that are going to be subsidized by government. And that often cannot be achieved because governments have tight resource constraints. Also, many countries make the mistake of assuming that they're going to be able to collect lots of premiums from informal sector workers and that these premiums are going to pay for the healthcare costs of that group of the population. That hasn't happened anywhere. Few people from the informal sector join. Those who join unpaid tend to be those who are very sick, and therefore the system becomes costly, and the amount that they pay tends to always be less than the actual cost of services, so government subsidies are necessary. Governments should not make false promises to informal sector workers.
Thank you, Ricardo, as I said, for a very interesting seminar, and I think many of the participants agree with me, judging by the comments that are being typed right now. So, as I said before in this, including the video PowerPoints can be found tomorrow on the e-Insitute website. You can see the link on your left-hand side of your screen. If you just go to e-insituteworldbank.org/webinar, you will /ei/webinar, you will see a list of webinars, and you can choose the one, so you don't have to type that entire long URL. You will see a long list of webinars that we organize there as well, so there might be some topics that are of interest to you. Also, to let you know that we will be doing a series of webinars on these topics of health and the economy, starting probably in August, and so keep an eye out on this webpage, the e-insituteworldbank.org/ei/webinar, for announcements on when these webinars are going to take place. Now, the last thing that I would like you to ask you to do is to fill out a very short evaluation form so that we can keep improving these webinars. I thank you all for your attendance, and it was a really interesting experience. So thank you very much for attending, and please fill out the evaluation form. Thank you. Bye-bye.